Can I now request Rotarian Anand Dalal to introduce our guest speaker, Mr. Dr. Zirak Marker.
Thanks, Sharni. Uh, Dr. Zirak Marker is a renowned child, adolescent, and family psychiatrist and psychotherapist with clinical training at the Westchester Medical Center, New York University. He is also a youth mental health first aider accredited by the Mental Health First Aid of Australia. He has over 19 years of clinical experience with educational psychology and guiding children with learning disabilities, development delays, autism, and emotional behavior or psychological problems. He is currently the medical director at the Aditya Birla Integrated School that is inclusive for children with learning disabilities and psychological, emotional, or behavioral problems. The school has been ranked first in Maharashtra and Mumbai and first in India by the education world over the last 4 years. He is also the advisor and senior psychiatrist at Empower, which is a holistic center of excellence with a multidisciplinary team of professionals providing services and therapeutic interventions for children, young people, and their families with mental health concerns and neurodevelopment disorders. He has conceptualized and helped develop Minds Matters, a bespoke research based holistic mental health curriculum for schools from grades 1 to 12. He has authored a book, Parenting in the Age of Anxiety, which is unique publication covering topics such as bullying, abuse, adoption, academic stress, disabilities, and death, among other hitting parental concerns. His second book, Conversations That Matter, is about fostering emotional well being in children whilst talking about the hard stuff. He has been a consultant at the Saifi Hospital and with previous attachments to Breach Candy and St. Elizabeth's as well. Dr. Marka set up one of the country's first inclusive schools for children with learning disabilities in 2004. This ran successfully for almost a decade. He has conducted innumerable workshops, seminars, trained and given lectures to students, teachers, parents, YPOs, EOs, and other professionals in Mumbai and across the country. He has published many articles for newspaper, magazines, and the media. A few of his recognitions. For his outstanding contribution to children with learning disabilities and education, Dr. Marker has been felicitated by the Macharji Adalji Joshi Memorial Trust in 2016. He was also awarded the Times Education Icon of India in 2017. Also, the Zoroastrian Trust Funds of India awarded him for his outstanding contribution in the field of education 2018. He has also received the Quality Leadership Healthcare section by the World Quality Congress 2019. He has been awarded the 50 top global mental health leaders by World Mental Health Congress and Healthcare Leaders 2019. He has been also awarded the XYZ ACE Award for contribution to mental health and education. And also the Online Parenting Summit in 2021, the Finer World Foundation awarded him for meticulous mentorship as a leader. We truly have a great speaker amongst ourselves. A little bit about Prakriti, who's also, sorry, she's also a Dr. Prakriti. Sorry, I stand corrected. She has also done a lot of work in the space of mental health through her foundation, the Poddar Foundation, and other avenues. So it'll be a very interesting conversation for us. Over to you, Prakriti.
Thank you so much, and good evening, everyone. This has been, when Anand told me about this conversation, I was quite excited about it because I know Zirak, and we live in the same building, but I've known him from way beyond that and way before that because he's so well known in the space. And if you get into mental health, I mean, you have to know Zirak, at least for the work that he's doing with the children, because any student that comes into our center, I'm like, 1 second, you need to go to Empower because the work they're doing there, at least the work that Zirak's doing, I don't know about the work that the space is doing, but he is so highly recommended for the youth that you wouldn't go to anybody else. So Zirak, it's great to have you here. And I have to say that even though your work is with the youth, your spectrum is really wide, and I know that these circumstances, especially at this point, I mean, it's like the twilight zone. It's ripe for mental health risks, and I think that the conversation today would be really beneficial to everyone, because what we're going to try to do is kind of move towards from a general understanding to a more detailed understanding as we drill down the various age groups and the demographics. So at any point, anybody in any stage of life will get something from this conversation. So welcome, Zirak, to this conversation and to our club. And if I can just start with asking you to just draw out the landscape of what mental health really is in a general sense.
Sure. Thank you for that elaborate, welcome, and it's an honor for me to be here. And so, yes, I can talk endlessly on what mental health is, and I think what comes to mind when the word mental and health is used is sometimes all about the disease and the illness part, right? But no one, like just now I had a session with a young adult, and he was talking about going to the gym to exercise. So I asked him that, do you go to the gym and exercise because you are unwell, or because you're looking at it from a fitness perspective and an overall health perspective? And he said, for health. And I said, then how come we never go to see a psychiatrist or a therapist when we want to just check in and ensure that our emotional well-being and our psychological well-being is intact, right? So mental health for me is a spectrum, right? Where you have wellness on one end of that spectrum, and of course, illness at the end of that spectrum, which is the emotional, psychological, and social well-being of an individual, right? And I think the one aspect I want to highlight here is that when you have a mental health illness or a disorder, it is actually termed as an illness because it is one. But the only aspect, or the kind of aspect that is still in research, is today I can do a blood test to know that I have, say, diabetes or a vitamin D3 deficiency or high cholesterol levels. But there is no way to singly diagnose through a test or a medical investigation for mental health. And that's why the clinical symptoms, right, are so important to kind of flesh out, to know what you're diagnosing, what you're treating, and how you want to take that treatment forward. But we have to know, and research has indicated that, like how we have hormones in our body, there are certain neurochemicals in our brain. And I think the most widely researched ones are dopamine, which basically help us with our thought processes and impulses. And then you have serotonin, which is responsible for your moods. Now, you may have any contributing factor or not, but if the neurochemicals in the brain, like serotonin or dopamine, get imbalanced, is when you can have actual, what we call as mental health illnesses or disorders like clinical depression or clinical anxiety or panic attacks or a bipolar disorder and all the other list of kind of labels that we have, right? So mental health is all about that. So there is the psychological and emotional well-being. And I think each of us here today have had emotional or psychological setbacks. And that's how I look at mental health, in that spectrum where you have, like I said, wellness to illness. But I think this is important to reiterate that when it is a clinical aspect, right, and it is a neurochemical imbalance in that sense, it is pharmacotherapy or medications that help, like how you would take a tablet to reduce your cholesterol levels, or how you would use insulin for diabetes. You do have extremely smart and intelligent treatment profiles for psychiatric conditions and illnesses as well. So it's an overall sense of well-being in that spectrum is how I look at mental health. And I think now more than ever in today's times, I think WHO is talking about now mental health being the next crisis after the pandemic, if not already a crisis.
That's true. I think at this point, mental health is already one of the most talked of issues, challenges across the world. The youth are definitely going through it. And I know that every single person who's every person is going through it in a different manner. And I know that it takes us to the conversation, but let me just recap for everybody else. What you're saying is that the spectrum is psychological, emotional, and then moves into clinical. So when the spectrum, when you get towards the clinical, it's only pharmacological medicine that will actually help with mental health illnesses. Otherwise, you can see counselors and therapists and also a psychiatrist to ensure that you are feeling emotionally well. And I love the point that you made about, come and seek help even before you need it, as a preventive and not a curative. And if we took well-being seriously, we would be doing a preventive across all our bands of wellness. So moving on to some of the key mental health challenges that you've seen in the different ages and what the challenges have been, and what you see the challenges becoming at this point, from like the kids to the teens to the sandwich generation, the elderly, and basically moving forward from there.
Well, I have kind of, to make it easier from an age perspective, because that's a whole spectrum, right, of the pandemic and its effect on mental health. So I think to make it easier, I've put them into 4 categories. One is, of course, with children. I call them the lockdown babies because they've either been born before or right bang into this lockdown, and they don't know what normal school life or a play school is, or some of them haven't been exposed to anything which we would do with our normal kids up to the ages of 7, right? Which is play school, nursery schools, kindergarten, play dates, birthday parties, loud sounds and noises, and swimming or just running in open spaces. They've been deprived of it all. So this age group, because all these aspects have been taken away from them, I'm finding a lot of kids with what we call as social deprivation. They, our parents have spoken about problems with fine motor skills, gross motor skills, balance, hand-eye coordination, getting extremely anxious and fearful, which is like an escalation of the separation anxiety, which normally also happens with most kids that age, and with over attachment and dependency, because they don't know better. Their world is their little bubble of their homes. And of course, because of being, babies or younger kids, parents are extremely cautious and should be, to kind of socialize and do the normal things like what babies and kids would do at that stage and age. And there is not only social deprivation, but sensory deprivation, where even kids that age who apparently have then slowly started normalizing or having their little bubbles of play dates, they don't know how to socialize. There's extremely, anxiety responses or fearful responses. And these are becoming challenges because otherwise, when you're going to a play school, I mean, there's sound, there's noise, there's auditory stimulation, there's tactile stimulation, there's visual stimulation, right? So that's what I call with the sensory deprivation. So we're actually guiding a lot of mothers and parents on how to stimulate these children's 5 senses and help integrate these 5 senses, because we're seeing huge chunks of lags and learning lags in these core areas. Between 8 to 12, what we're seeing is kids being overtly dependent and almost addicted to their gadgets. I mean, they're finishing their online schooling, and I think kids across right now are going through what we call as online burnout. There is a lot of, you speak to most parents, there's irritability, frustration, headaches, posture problems, backaches, finishing with online schooling and going back to their gadgets or phones or iPads or games. I know kids sometimes who are spending up to ridiculously long hours, anywhere between 12 and 15 hours on gaming, gaming like Minecraft, Fortnite. Some of the games are incredibly aggressive. And parents are actually, stating, and I'm seeing kids who are so comfortable online with the virtual world, and they're completely, uncomfortable with their social skills when it comes to, real time or FaceTime kind of interaction, right? We are also seeing kids who are literally on the pre-diabetic state because, unhealthy sleeping habits, unhealthy diets, not sleeping right, circadian rhythms completely, topsy-turvy, and tons of, every 1 in 3 kids today have been diagnosed with either B12 or vitamin D3 deficiency because they've not been exposed to outdoor activities or natural sunlight. Then, of course, you have the 13 onwards, which is your anyway a difficult age group, right? You have teenagers. And what we're seeing a lot, yes, there is a lot of just the virtual world. Now, with the virtual world and excess social media comes its own risks. So we're seeing a high surge of what I call as inappropriate usage of social media, pornography, lot of risk-taking behavior, so a lot of interaction and dating with perhaps strangers. And the biggest fear right now that's been coming up, and we are in lots and lots of talks with upcoming cybercrime and the police department, because we're looking at the dark web. So it's not just pornography anymore. We're talking of pedophiles who are propagating businesses and what we call as grooming. They're grooming young teenagers and young adults sometimes in that direction. We're looking at a lot of inappropriate content that comes up even when kids are browsing. And the worst part, which I was talking to Prakriti about, and what we're seeing a high rise in, is these virtual groups. So when you're anyway, say, frustrated and bored and you're online all the time, you don't know. And if you're emotionally disturbed or stressed and you're going to be interacting with a whole gang of other teenagers who are as depressed or as anxious around the world, they're forming groups and giving you inappropriate strategies of coping with stress or distress. And the most common one is these crazy groups that tell you how to self-harm. So these self-cutters, where they're actually propagating and telling kids that it's okay, like if you're emotionally disturbed or you're emotionally in pain, cut yourself. That will numb the pain, or that's the best way to cope with pain. So there's a lot of this propagation of negativity and things like that. So that's something we need to, as adults or stakeholders in education and as parents, be aware that that's a huge rise that's coming up. And surprisingly, despite the lockdown and basic amenities not in place, there's a high rise of substance abuse, especially with marijuana. And the sad part is there's so many parents who are misinformed, who feel that marijuana is not a drug, it's not unsafe for their kids. And sometimes parents surprisingly tell me that they feel it's safer than drinking and smoking, which is not, because at the end of the day, marijuana and weed is also a substance. It's also addictive, and it's so harmful for kids. We're talking of, marijuana-induced psychosis. You're talking of marijuana-induced panic attacks, depression, cognitive decline, problems with memory, focus, and concentration, further worsening ADHD symptoms, and a whole spectrum of other problems with regards to that. And of course, then you have your actual mental health concerns. So we're seeing a huge rise in anxiety, panic attacks, kids or young adults who've already had obsessive compulsive disorder. You can imagine how the pandemic could have heightened those symptoms and made those symptoms far worse. And of course, so many, and the most heartbreaking is dealing with kids between 9 or 12 or at any age group who've lost both their parents to death because of because of COVID-19. And I think that's the most heart-wrenching, and the post-traumatic stress disorders that we're seeing are huge, with a lot of anxiety and actual post-traumatic stress disorder symptoms, because when parents have either gone into hospitals or parents have passed away, there's no closure for these children because there's been no allowing them to go next to them in the hospital or even on cremation grounds. So that's another whole spectrum of acute stress that's happening. And of course, we're dealing with that. We're dealing with a lot of death and bereavement, and loss is not just loss of parents or loved ones to death, but I think a lot of loss of the social structure of what we're living through, with loss of jobs, a loss of contact. I mean, there's so many people stuck in different parts of the world, students stuck in Bombay, unable to go and fulfill their dreams. Sometimes I know parents who've saved all their earnings into sending their kids abroad to university, that's been stuck. Or they've gone there and they've had no campus or college life. They've done all their education online. So yes, I've tried to sum up as much as I could as to what all the the kids and the youth are going through, which is a lot. And another thing, if I ask you if you remember when we were younger, our summer break felt like a year. I mean, I remember coming back to school and not even recognizing some of the classrooms or feeling things had changed. Now, can you imagine how 1.5 years is? Like, I have a 10-year-old and an 8-year-old. They've forgotten what school life really is. They don't know. And there's so much of anxiety. As much as I've tried to shield them and make this whole bubble a fun zone and a fun bubble for them, they are anxious. They break down every second or third week in the fear of either something happening to us, questions about death, it's in the news, we're talking about it, they're subconsciously all going through some form of anxiety or the other. So we need to be aware that this is not the beginning. This is the beginning, yes, but I think it's going to percolate and get far, far worse if we're not prepared. And yes, mental health is already a crisis in existence, if not already becoming one.
I think one of the things, after you mentioned this to me about the self-harm WhatsApp groups, which actually I was like a little bit surprised about. I didn't realize that there were WhatsApp groups floating around which were sort of encouraging self-harm. But when you told me about that, I mean, I went to my son's phone and I'm like, can I have your phone? And he was like, why? That's really an invasion of privacy. I'm like, you're 13 years old. There's no privacy. Okay, just show me your phone. Anyway, he doesn't show me his phone, but then he starts laughing about something and he shows it to my other son. And I'm like, what is this? He goes, oh, it's really funny. It's a mime. And all I can see when I see what he's seeing is two people really hitting each other badly, like beating each other up with some music in the background, which is very far away from what's actually happening on screen. And he's laughing. And I'm like, I don't understand. What are you finding humorous in this? And I got nervous. I was like, wait, what is he feeding? What are these children actually feeding? Because he got it from somebody else and it's become a really big joke, but it's not a joke. It's violent. But it's, what are those newer pathways that are getting crossed where they believe now that this violence is actually humorous and they're spreading it and calling it mimes, and every child that is, this was from the university, from the school that he's in Vancouver, and everybody's kind of going through this. And we all know, at least in the West, there's a whole lot of push towards diversity and inclusion, and it kind of ties in a way, because this is, you can see two different races fighting with each other, and it's being, propelled out there, and people are still sort of, I feel like there's some kind of desensitization going on, like a mass desensitization. And I'm wondering if you have any thoughts about this, and how do we actually prevent our children from doing this? Because I can say to him, hey, delete everything, and he kind of had to delete everything. He says, oh, I don't have anything that's appropriate if you think this is inappropriate. And so he deletes everything. But this is really scary for parents and for teachers and for any stakeholder of the youth.
Sure, right. So it's not just this. You were talking about these, videos and games. Those are just videos and games which we are aware of. The most unhealthy are these new voyeuristic and realistic, awful videos that pop up on no matter how many parent blocks. That's what we were discussing with the cybercrime, that when you're looking at a dog beaten to death, what impact would that have on a child? Or you've tied up firecrackers on a dog's tail, or you've cut open an animal. We're showing these kind of gross aspects, it leaves a lot of psychological scars and traumatic experiences. So when you look at trauma can come in all sorts and all forms. And then you have cyberbullying. You have no idea how huge that has also become, because right now, like I said, there's so much of exposure to screen time that kids have become more deviant. I don't know whether it's out of boredom or they have pathologies already existing within their persona or their personalities. There's lack of supervision, and they're putting up morphed photographs of their own friends. There is a lot of sexual harassment or sexual trolling that happens even amongst 10, 11, and 12-year-olds. They're creating hate WhatsApp groups or hate Instagram profiles with a lot of comments against students, and a lot of this is going on. So I think what we need to do as adults is two things. One is create that awareness. You can't be afraid of having real life conversations to our kids about them. And I know many parents or adults ask, but what's the right age? My answer to that, the most common is, okay, so when do we talk about the birds and the bees and give sex education to our kids? And my answer to the parents is the minute they start understanding the English language. Now, why I say that is because if you read statistics and research, 80 to 90% of children who are sexually abused are under the ages of 7 and 9. So age appropriate conversations, when you start having these, one is that you're normalizing these concepts, you're normalizing mental health, you're providing the right vocabulary to them to make them understand things as to what they're exposed to. Don't forget, when we were 15 and 16, we were babies. Today at 15 and 16, I think they're going on 21 because of the exposure that they have and the parenting styles that we've tried to achieve to either westernize or just to be more open and communicative with them. But that's the world. That's the realistic approach that we need to not run away from. We can't run away from technology. I mean, I have sometimes parents who've gone on the extreme, very proudly telling me my kid's 7 and we don't watch television. Or my kid's 6 and we've never shown him or her an iPad. And I'm like, but that's the world. If nothing else, this pandemic has told us that the whole world is going to go through huge technology jumps and leaps. And I think there's so many benefits as well. Like today, for example, we've got 58 participants together, and we could be anywhere in the world, like you, Prakriti. And like sometime back, I had a kind of a workshop with a school in Jaipur with 5,000 parents. I mean, you could never dream of housing 5,000 individuals under one roof. So there are a lot of advantages, but I think if we're more mindful on our conversations, we bring risk factors into conversations with children, give them reasons why you're being strict or firm or setting boundaries. And I don't know why parents are so afraid of disciplining their kids. And I believe in the hardcore disciplinary action of tough love. Sometimes a no is a no. And yes, they don't want to only hear no because I'm saying no, but then give them an age-appropriate, rational explanation of why safety comes first. What are risks? Why are things age-appropriate? You can't shy away anymore from these conversations because, like I said, there's too much of exposure around and we need to be cognizant. And the second thing, and I tell this to all schools, we have to have a social emotional learning and a mental health curriculum in schools. It's okay to have one less geography and history class because no one teaches us these things. And who teaches us about death and bereavement? Right now, in the school I run, the grandfather has passed away through COVID. The child is 9 years old. The parents have kept it as a secret from this child. They feel that he's going to be very traumatized. And my outlook is so different. I say, no, you have to talk to your children about death. Death is part of life. If you use a scientific approach, talking to them, I had to sit my child down and talk about death as well. I had to sit and talk to my 7-year-old when we were traveling overseas, when they saw 2 men kissing on their lips. We had to normalize the aspect of diversity. We told them, we didn't snigger and laugh or put that down because that worsens the marginalization. Inclusion is important because we are hoping that our kids in the next generation would be global citizens. You can't hush all this away. I mean, like I was giving an example, like I told my children without much thought that yes, it's normal for a man and woman to fall in love and get married, but it's also normal for a man or a woman and a woman to fall in love and get married and have kids. And they both looked at me shocked, but that is the reality of today, and why not? And if we don't teach our kids today to be more compassionate, have more empathy, have more inclusion, normalize these things. Don't put down someone with dyslexia or a disability. Don't laugh at someone who's got a different religion kids can be so nasty today. I have kids who bully kids on skin color, on the cars that they come into school from, on the designer or not so designer t-shirts that they're wearing. I mean, the list is endless, and I don't look at it as the children's fault. I point fingers at the parents. I think that the way we bring up our kids has to be with tough love and more emphasis on emotional intelligence. And I come down really hard on my kids if they're not nice to other kids. You can't turn your face away and use the expression that, oh, boys will be boys, or let them deal with their own fights and their own battles. No, we have to have our kids' backs. We have to navigate them and teach them what's right and wrong. And we have to teach them about empathy. And I think if we all collectively do these things, then only can we talk about safeguarding the next generation's mental health, because these all attribute to risk factors.
That's a good point. I want to talk about the sandwich generation, but I want to start with actually talking about the elderly so that we can sort of weave into the sandwich generation. I know that at Poddar Foundation also, there's been so much work that we've done with the elderly at this point because it's such an important aspect. So I'd really like you to talk about what's happening with them, what's the risk factors, what's the fear, the anxiety, because they've also it's got magnified for them during this period as well.
So you're right. So of course, the elderly, I see my own parents struggle. And first of all, I think there's no use of movement, right? So normal socialization, walking, exercising, all the things that are supposedly good for health, good for mental health, have been taken away from them. There's a deep sense of isolation, loneliness, and lots of anxiety because, simple things that we take for granted. Today, I, as a 47-year-old, struggle. I had never done an NEFT on my phone. Through the lockdown, well, that taught me something new, and now it's automatic. But my parents sometimes, or others I know of, they struggle with even sometimes sending text messages, right? Because they are not born of the generation of technology. So how we connect through Facebook and Instagram and social media and can read our newspapers on our phone. But when you have eyesight failing, when you are not tech savvy, when you don't know how to make NEFT payments and you're so dependent on all these other aspects on others, it becomes really, really challenging. And I've seen, especially in that age group, when you've had the pride of autonomy and responsibility and independence, and then suddenly it's all taken away from you, you're feeling trapped, you're feeling isolated. And the worst part, I think, the feeling of incapacitation. That's what most of my clients who are stressed are feeling incapacitated because they're stuck when they can't do things which come naturally or normally to the younger generation. And of course, the anxiety that, God forsake, if something happens, I think all our parents and grandparents fear that, we've always been with them, whether it's in a hospital room. This is like a new stressful factor, I think, for every human, that if we go into hospital, you have no loved one beside you. And that itself is mortally frightening to even envision happening for our loved one. And I think those are the main stressors, I think. And of course, you age faster, your immunity has dropped because you've not been exposed to normal external environments. So right now, we're just telling every individual to keep moving, even if it's just walking up and down in the house, trying to go to a window, get as much as, fresh air and sunlight, or taking tons and tons of supplements like, your omega-3 fatty acid, your vitamin D3, your calcium and magnesium, your zinc. So, eating healthy, keeping the mind constructively occupied through reading newspapers. And I think it's up to us to constantly, FaceTime or video call and be in touch with even neighbors who live alone, whether it's small gestures of pro-social behavior, I think is what's kept all of us going. Reaching out compassionately to people around us, to neighbors who are alone, to grandparents who are alone. I think it's up to us to constantly touch base, even more than once a day, that will keep them going.
I know that we had so many patients, so many people call in for their parents who suggested that their parents may be going through what we would describe as catatonic behavior. And that was really scary. I didn't understand why that trend took place, but there are a lot of people who just went into lockdown, internal lockdown, and it's caused a huge problem. And I think that the people that are dealing with it most are the sandwich generation, because we're dealing with the youth, with our youth and our children, and we're dealing with our elders and our loved ones. So it becomes really difficult for them. And because work is still a priority for that group, I know that they're dealing with a lot of different problems, which I hope that you can highlight some of those risk factors and red flags for them as well.
So you're right. So basically, I think so. What you're talking about is, in fact, a new concept that's coming up. It's the lockdown fatigue, as we're calling it. So there are a lot of adults, children, and elders who are going through this set of symptoms of lockdown related issues. One is, even though you're home, there's a lot of mental fatigue and physical fatigue, mood fluctuations, excessive lethargy and oversleeping, or then imbalanced circadian rhythms, where sometimes teenagers are up all night and sleeping all day. I know a lot of elders who are sleeping through the day and the night, and sleeping up to 17 or 18 hours a day. A lot of what we describe as a mental fog, difficulty with memory, with registration and recall, or feeling just a sense of helplessness and hopelessness. So low moods or irritability in moods, feeling overwhelmed, and almost like a Stockholm syndrome. So even now, when things are slightly normalized, I know so many people across are afraid to go back to normal. That there's a Stockholm syndrome in psychiatry, which is quite interesting, where they say you identify with your kidnapper. It's literally like, we've identified with the damn virus and this whole new lifestyle change, and it's difficult to come back to what we call as normal life. So that's a big struggle. So in fact, we're teaching parents how to even prepare kids to start realizing that they have to go back to school and normal life and normal socializing. As adults, we have to get over our fears. I know so many adults have been now mandated to come back to work at least 2-3 times a week, and they're refusing because there's anxiety suddenly. People who have gone back to work are experiencing headaches and more fatigue because they suddenly, it's traffic and traveling and weather changes and everything that's out of the norm, which is actually what we were all doing normally. But the risk factors here for mental health, coming back to that, I think one is, of course, everything that we've discussed till now, right? Which is pandemic related or others. If there's a family history, always remember that if, like mental health disorders are also genetic. So if there is an aunt, uncle, or a parent who's had a family history of either psychosis or schizophrenia or depression or bipolar, there is a high predisposition for loved ones and family members to also get or attain a mental health concern. Of course, the second big risk factors, as we call it, are life-changing events. So shifting homes, financial losses, huge job changes or job-based stresses, death, chronic illnesses in the family or loved ones, all those pose as big life-changing events. Or even things like marital discord, divorces for both the individuals going through it and for the children, family conflicts, abuse, physical abuse, psychological abuse, sexual abuse, and trauma like earthquakes, accidents, rapes. These are all what I can put forth as risk factors. And definitely there are some, this is very important, there are some health conditions which are clear contributing factors. So the symptoms could be depression and anxiety, but vitamin D3 manifests with mental health symptoms. Severe thyroid, so either hyperthyroidism or hypothyroidism, can actually mimic symptoms of panic attacks, anxiety, sweating, mood swings, irritability, or depression. Then you have diabetes also. So there are a lot of underlying endocrinological or hormonal imbalances and medical problems. That's why when we also see clients and families, we don't immediately label someone with a mental health concern. At least I definitely do a robust set of investigations or blood workups and checkups, rule out other underlying medical contributing factors, and then work out a treatment plan if it is a psychiatric or a psychological condition. And of course, bullying. So a lot of kids who've gone through severe bullying and bad times in school, or a learning disability like dyslexia, which sometimes goes undiagnosed, and sexuality. Lots of children struggling or dealing with their own sexuality these are all the contributing factors, Prakriti, for mental health concerns in the future.
Yeah. And I think that the last point that I really want to shed light on is that a lot of us lead organizations, and, it becomes really important for us to be sensitive towards mental health issues that people are facing, and also how do we support them from a point of view of being the leaders in a sense, for these groups. I think that becomes like a really important aspect, because people are losing, very good talent, because the talent is kind of going through a challenging time at this point. How do we support them? How do we identify what's going on, and how do we support them in this time?
Okay, great. So one is definitely, so what are these risk factors, right? So one is, I think, through platforms like this, right? I mean, the more you bring about awareness, you're increasing the level of knowledge through awareness. If there's increased knowledge and awareness, there's more signs that you can pick up, even as lay people. The minute there is an intuitive gut feeling that yourself or your loved one is not okay, propagating, reaching out for help. Because truly, I believe in this, and I think it's with anything that's medical, something like cancer, right? The earlier you intervene, if it's stages 1 or 2 and there are no lymph nodes involved, and you start your treatment or chemotherapy early, you have far better treatment outcomes and recovery. It's the same with anything that's medical, and more so with mental health. Another interesting aspect I want to bring up here, WHO has recently, of course, they've told us that India is the most depressed country in the world. That's one most alarming statistic, right? The second most alarming statistic is that suicide is the third leading cause of death in our youth today, more so in India again. As we speak, there is one attempt of suicide every 3 seconds and one death by suicide every 45 seconds as we speak. Now, when you hear these alarming things, and what was most alarming for me to research was, by the time there's the onset of mental health concerns, and by the time individuals or family members get treated, can you guess what the time lag is? It's 8 to 10 years as an average. 8 to 10 years by the time there's the onset of mental health symptoms and treatment or intervention. So when you see this lag, you wonder why. Why has there been an 8 and 10-year lag between the onset of treatment, onset of symptoms and treatment, right? That's because of, we will be explaining what those stigmas are as well. But one has to be cognizant of what these risk factors are. One is what I told you. We all go through psychological and emotional problems, right? But sometimes when there are no external factors, like say there's no death, no loss, no family problems, no conflicts, everything seems on its surface great. And I still feel from within that I'm not okay. And that feeling doesn't go. Now imagine that feeling escalates, where suddenly I'm losing interest in almost everything, right? There's a sense of helplessness, hopelessness, worthlessness that sets in. I'm constantly feeling like I'm in a brain fog. I can't make simple decisions. I can't remember things. I'm forgetting things. I can't make certain choices. I'm struggling to enjoy all the previous pleasurable activities that I would enjoy. I don't like going out. I suddenly don't. I'm losing interest in picking up the phone and speaking to close ones or loved ones. I've been invited for outings and dinners and I don't feel like going. I'm suddenly feeling that I can't function. So even the smallest of impediments or issues or stress or things I have to deal with, I don't want to deal with it. I'm losing interest I'm feeling that everything is overwhelming. I suddenly feel like I'm reduced to tears. I suddenly start getting panicky, or I get this tightness in my chest, or I'm getting headaches or body aches or backaches. A lot of stress-induced symptoms are coming up. Feeling hypersensitive about the smallest of things. When I look at it rationally, I'm wondering, why did I suddenly yell or shout or feel irritable and angry or upset? Sometimes I'm getting thoughts of, not living. I get suicidal ideations. I'm thinking of ways to end my life. I'm constantly, feeling that I'm not good enough, or there's a sense of low self-confidence, low self-esteem, low self-worth. And the main thing that will tell you that either you or your loved one is going through something that is clinical is when all these symptoms start actually affecting my day-to-day function. I have clients who've not got out of bed in 4 or 5 days at a stretch. I have clients who've not had a bath or shaved for days on end. I've had clients who've created a plan for their suicide and their ending. They've written their notes, they've packed away things, they've given away borrowed stuff, they've closed bank accounts, right? Uh, you can see changes in body language, sleep patterns change, appetite patterns change, and there's clearly something off. And if you look at it, behaviors, emotions, and physical symptoms, there's something going wrong in all those entities. And when the feeling or these symptoms don't seem to shake off, you've tried counseling sometimes, you've tried talking to a best friend, you've tried everything, and it's not going, means you need to seek medical professional help. And I promise you, we as psychiatrists are not scary. We're not going to catch you and label you with a diagnosis or give you 20 drugs. And these are, can I talk about the myths, Prakriti, as to what doesn't allow us to seek help, right? Because it ties in, I'm seeing there's so many. So what are these stigmas, right? One is we all feel with ourselves or with our loved ones that, oh, this is a passing phase. It will go away. Then we hear this innate chatter and this typical advice that loved ones give us. Oh, go have a drink, you'll be fine. Go meet your friends. Focus only on work. Or get married, you'll feel less depressed if you're single, that is. Some will be as silly, and the teenagers especially, go smoke a joint and just go chill, have a drink, party with friends. And many people, even the educated ones, feel, oh my God, am I mentally weak? Parents feel ashamed that my son can't have depression. Am I a bad parent? So there's this whole huge stigma that brings up that, is this a weakness? Is this something lacking in my personality? What will people say? What will society feel? If I'm seen at a psychiatrist office, what if I bump into someone I know? What will I tell them? Oh my God, if I go to see a psychiatrist, I'll be put on medications which I have to take for life. I will gain weight and become fat. I will get dependent on them, and I will never be able to let go of them. This is all bullshit. You will never be given medications that you have to take for life. Every medication is properly, thoroughly FDA approved, scientifically researched, and you have such brilliantly amazing, safe drugs, which even 9 and 10-year-olds can take. You have to follow a proper treatment plan. You have to understand that all medical treatments for psychiatric or psychological issues have a course period. There's no quick fix. It's not a Crocin effect. It's not like taking a Crocin and the fever gone or the body ache gone. These take time because, like I explained at the beginning, we have neurochemicals. The drug has to get absorbed in your blood-brain barrier. Then it starts slowly regulating the dopamine and the serotonin levels. And then you will see respite in your symptoms after 1, 2, and 3 weeks. Another second mistake. I'm feeling fine in a month. I'm feeling 100% fine in 2 months. Why do I need the medication? And this is the biggest mistake of what we call as treatment fallouts or relapses. You have to complete the course over 6 to 9 months. For children, for teenagers, and for adults, minimum. Research has clearly indicated that even for the mildest of depression, if you stop your treatment before the 6-month period, there's a 50% chance of a relapse of symptoms. So this is what I just wanted to share. And of course, don't go doctor shopping. Don't Google. This is silly because people go so much on the internet and then you suddenly read all these side effects. But think about it: every drug you research, which is the most what I would say is the most abused, dangerous drug. It's a drug that all of us on this platform that keep using, which is paracetamol. You want to kill yourself, you have 40, 50 paracetamol tablets or Crocins, you will end up dying with multi-organ failure and suffering. You swallow 20, 30 sleeping tablets or psychiatric tablets, nothing will happen to you. That's how safe they are. So what I'm getting at is these are all myths in our minds. They don't have gross side effects. Yes, unfortunately, psychiatrists today over-prescribe, over-medicate. But you have to find the right therapists and the specialized individuals in mental health and follow treatment paths. And of course, have a holistic approach. You can't treat mental health with just one pill. It's medication, it's therapy, it's counseling, it is lifestyle changes, it is physical exercise, and gut health. Please understand, gut health and mental health and physical health are all interconnected. You can't treat one without treating the other. Sorry, I can go.
That's good to know, because most people don't say that, but I truly believe in the holistic approach. I want to leave the floor open now for people to ask you questions, Zirak, because I'm sure people do have some questions, and we're also running out of time, so I don't want to take up more of your time. So I'm opening the floor for any questions, whoever would like to ask Dr. Zirak a question.
Zirak, I have one question. Anand, how important is recognizing the need for seeking help, and how much of the battle is won at that stage actually?
It's fully one, no? Because if, like, say, if I'm like today, I discussed all the symptoms with you. Now, if I'm going through them as an individual and I'm not sure whether this is something that's psychological or psychiatric, do I need counseling, or do I need to get a blood test, or do I need to whatever I need to, right? What's the harm in seeking help? Now think about it. I've got a toothache that's lingering and not going and getting worse. And by the third or the fourth day, my jaw is swollen up. Will I go and see my general physician, or will I go and see my dentist? That's the answer for you. You have to understand that now, with everything that's science and medical based, there are super specialties, and there's absolutely no harm and no shame. In fact, 80 to 90% of my clients are on that wellness spectrum. I don't treat them with medication. I do a lot of therapy work and counseling with them, which is thought management and more like a life coach, if you may say. And that's what also helps a hell of a lot with a lifestyle change, with a diet plan, and with all the other stuff that we spoke about. So early intervention is huge in recovery. When you pick up those warning signs and you pick up the right way of thought and a treatment plan, you have some super fantastic recovery aspects.
Thanks.
Thank you. I think, Satyan, you had a question.
Hi, Dr. Marker. This was really insightful. In fact, coincidentally, my son is in ABBA and he's in grade 2. So 1.5 years of school, he was going to physical school, and now 1.5 years he's been in online school. What are the pointers should we keep on watch out for as parents, just to see that mentally he's fine? Because it's getting a little bit of fatigue we can make out now with the whole Zoom thing every day, day in, day out.
Sure. So very, very good question. Thanks for that. With kids, you have to, and I'm telling this to all parents right now, is yes, the online education is important. Schooling is important. There are going to be academic lags because online education is not ideal, because there's no multi-sensorial approach. There are no audiovisual aids. There's no fun and games and social interaction and sports and all that our kids are deprived of. So one has to simulate that in your child's day. So yes, the school time and education, I think most schools are doing a great job in being mindful on reduction of, say, their hours of school, etc. But it is so important to focus on their mental health. Give them talk to them every single day, verbalize their anxieties, talk about going back to normalcy, collective responsibility. Think of something new and creative every single day. Physical exercise and activity. You can do loads at home. You don't need a big space or a small space. You can do lots with imagination. And if it's done collectively, add humor and fun every single day in every single thing that you do. Keep vigilant for warning signs. There will be moodiness. There will be irritability. There will be times when, older kids and adolescents will want time out and their space and, independence. Provide them that respect to have their timeouts. Teach them empathy, gratitude exercising every day. We take so much in life for granted. Teach them that there's so many small things to feel grateful for. I, for one, I've never had the best time in my life with my family because I'm at home to see them. I can tuck them to bed in the nights. Otherwise, I would come home and they'd sleep. I have every meal with them. So small things make it big. Small enjoyments, celebrations, birthdays, make a big thing of it at home. And like I said, breaks, balance, structure, routine, ensuring sleep time, routine time, TV time, screen time. You have to be a bit firm on all those aspects. I mean, that's the best I can say for now on this platform. I can go on with that because there's a lot that one can do to be more mindful at home, especially with parenting.
Thank you.
Jagdish, you had a question?
Sorry?
I think
You had a question, Jagdish?
Yeah, I did. A little off the thing, Doc, fascinating talk. We live in such politically polarized and sort of jingoistic, nationalistic times. What is the effect of this kind of atmosphere in the country? And of course, there's probably more true for Delhi than Bombay, which is more a commercial and apolitical city. But what do you find among the teens? What are their reactions to these times?
So, see, teens and all our kids are role modeling us. Like when I brought up empathy and compassion and inclusion and exclusion and acceptance, it comes from where? Kids, yes, they speak to each other, but when they role model their friends or they talk like how their peers are talking or speak in the language their friends are speaking, it eventually comes from us. So what I try and do and I try and propagate is to all of us. We all have our views about politics, about religion, about communities and marriage and all sorts of pros and cons. Allow our kids to have a voice and an opinion. Because I mean, like simple examples. Oh, when you grow up, you must marry a tall, dark, handsome man, or a very pretty and a fair woman, someone who's from a good family. What defines a good family? Why should you marry a wealthy family? And things like that, which are sometimes so ingrained and conditioned from grandparents to kids and parents. So much of conditioning, and I call that it's bias. It's unconditioned bias that our kids are going through. We have to recondition their brains into not propagating what we think is the right and wrong. Because yes, I'm not talking of drugs and violence. I mean, there are clear-cut rights and wrongs, but these in-between topics, right? Very important to give them a neutral view. Because it comes from us, our strong views and beliefs. If we condition them with that, they will grow up naturally role modeling us and believing us. So always having a neutral stand sometimes, giving pros and cons, always. And I believe that in life, everything has a perspective. So teaching them to see the positives and the negatives. And this is that one line I love and I live by, is the silver lining concept. And if we can teach our kids that, I think they'll become more resilient. And at the end, what do we want our kids to be? Sound in mind, body, and resilience, which is the inner strength, not just to be able to go through all of life's challenges, but to bounce back stronger with healthier coping mechanisms. So being neutral, being compassionate, being that effective role model for our kids is what this next generation really, really needs.
Thank you.
Thank you, Dr. Marker. I'm wondering, do we have time for Manish? Shall we take one more question, Doctor?
I can go on. I have verbal diarrhea, according to my friends, so I can go on speaking.
Manish, you want to take the last question? Oh, he's not. I don't think he's there.
Muted.
He's here.
Muted.
Yeah. Hi. Hi, Doc. Manish here. Doc, I had a question that's in this pandemic, and many times it has happened that the senior citizens not been out of the house, or they have lost their loved ones, their spouses or something in this pandemic, and this has led to them getting into a major depression. But they are not willing to accept the fact that this has got into a depression, or they would not want to seek any medical help, or they want to go and see a doctor or things like that. Under that circumstances, how do you manage to get them to a doctor or to get them the medical help which will help them come out of that situation?
Very good question. In fact, I'm dealing with lots of cases like this. So, see, like I described, right? Sometimes it's psychological and emotional. So it's natural when there are so many external factors, losses, changes, they are going to slide into that emotional setback for a period of time. Now, when these symptoms, like I said, scale up and don't get better, even after 2, 3, or 4 weeks, and when it is impairing their day-to-day functionality, as I said, again, of sleep, appetite, sometimes with anxiety and depression, I have adults who've lost like 5, 6, 8 kilos in about 2, 3 months' time, not been sleeping well, fainting, fatigue, and all the other symptoms that we spoke about, and yet they're not open or accepting of seeking professional help through a psychiatrist or a counselor, then we need to step in, get the thorough clinical history from the loved one or the kids that are living with them, and start them on medication, safe medication. And unfortunately, unknowingly, you have to tell them that it's perhaps to just keep your pressure balanced, or it's for stress, like kind of guise it under. And to be honest, some of these medications are also prescribed by cardiologists, because they keep the heart rate a bit low, they keep the blood pressure down, they keep, it's like a mild kind of an anxiolytic or a mild antidepressant that's usually safe for a specific age, then can be prescribed perhaps like that. Yeah. And I've seen huge recoveries, because if you don't, you have a complete slide down. And I've had clients where I've actually told them that, this is looking like actual clinical depression, and they've not sought treatment or not given the right medication. And after 3-4 months, a lot of deterioration. Because like I said, physical health, mental health, gut health, it's all interconnected and related. So one is bound to affect the other in time without intervention.
Thank you, Doc. That was really good.
Several people wanting to ask questions, but I think we are way past time. So perhaps we close the meeting now. Dr. Akshay Batra, would you please give a vote of thanks?
Absolutely. It's my pleasure. Thank you so much, Dr. Marker. I think you really explained the subject wonderfully. I must admit, as a parent, I'm also a little concerned with what's happening around society. But thank you for sharing it so beautifully and sharing the ways that we can address this challenge, particularly with our children and our loved ones. I think the big challenge is really awareness and acceptance. And I wish you all the best in your fight and your journey in, making sure that Indians accept mental health seriously and treat it accordingly. A big thank you also to Rotarian Prakriti Poddar for wonderfully moderating the session. Thank you so much. I know it's a very early morning start for you, and really appreciate you being there to take this forward. As a token of our appreciation, Dr. Marker, for you spending the evening with us, we will on your behalf plant 10 fruit-bearing trees at Nilmati Dandwal Gram Panchayat, Maharashtra. The said certificate will be forwarded to you shortly.